non-small cell lung cancer, or NSCLC, is the leading cause of cancer-related deaths worldwide, with approximately 5% of cases driven by mutations in the anaplastic lymphoma kinase, or ALK gene. These mutations create abnormal ALK fusion proteins, with constitutive kinase activity, triggering downstream signaling pathways such as the PI3K-AKT and the RAS-RAF-MEK cascades. This abnormal activation causes cancer cells to grow uncontrollably and spread. Usually, ALK-positive patients tend to be younger than the average lung cancer patient and are non-smokers. Ensartinib binds to ALK tyrosine kinase, changing the protein's shape and making it inactive. This inhibition blocks the phosphorylation and activation of ALK, halting the signaling pathway that fuels tumor growth. Ultimately, ensartinib suppresses cell proliferation and induces cell death. A key advantage of ensartinib lies in its efficacy against a diverse spectrum of ALK mutations, including those that confer resistance to first-generation inhibitors like crizotinib. Resistance often arises from secondary mutations within the ALK kinase domain, impairing the binding of earlier drugs. Ensartinib's unique design effectively counters these common resistance mechanisms, making it a valuable treatment option for patients whose cancer has progressed despite prior ALK inhibitor therapy. Beyond its primary target, ensartinib can also inhibit other tyrosine kinases, including ROS1 and ABL1, potentially expanding its therapeutic use to treat tumors driven by these factors. In December 2024, the U.S. Food and Drug Administration approved ensartinib, marketed under the brand name Ensartinib, for the first-line treatment of patients with ALK-positive, locally advanced or metastatic non-small cell lung cancer who haven't previously received an ALK inhibitor. Before this FDA approval, ensartinib was first approved in China in 2020 under the trade name Bimina. The FDA's approval was based on data from EXALT-3, a global open-label randomized trial that compared ensartinib to crizotinib, an older ALK inhibitor. The primary endpoint of the study was progression-free survival or PFS, which measures how long patients live without their cancer worsening. Ensartinib doubled median progression-free survival compared to crizotinib. Patients treated with ensartinib experienced a median PFS of 25.8 months, which is more than double the 12.7 months observed in the crizotinib group. However, there was no statistically significant difference in overall survival. Prior trial results demonstrated that ensartinib was more effective in treating brain metastases, commonly associated with ALK-positive non-small cell lung cancer. In patients with measurable brain tumors at the start of the study, the intracranial response rate was significantly higher with ensartinib at 64%, compared to crizotinib at only 21.1%. The FDA's approval of ensartinib provides a significant advancement for patients with ALK-positive non-small cell lung cancer. This new medication expands first-line treatment options and demonstrates superior efficacy compared to crizotinib, reducing the risk of disease progression or death by 44%. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.